Hello and welcome to The Society with Fatma Shaheen at PTV World. Today we'll be discussing the resurgence, for that matter, of the Omicron subvariant virus as it does exist not only in Pakistan but world over too. We'll be talking about our various societal attitudes which unfortunately one way or the other, actually attribute or contribute towards the transmission. Having said that, a very important thing which we'll be, delving upon during the course of today's conversation is the fact that when we talk about the Omicron variant, how precisely is it different from the other variants which were there before? Having said that, we'll also be talking about the possible challenges that it might actually place not only on doctors but also on the healthcare system, so to speak, if not now, perhaps in the upcoming months. And last but not the least, a very important thing which we will be, talking about during the course of today's show is the fact that when we talk about combating the transmission, when we talk about, actually limiting it, what role can young people, what role can, community members, what role can society at large play, especially when it comes to stopping the spread? This and much more to follow on today's show, and to do that, let me introduce you to my today's panel. My first panelist for the show today is Dr. Javed Hayat Khan Saab, who is a consultant pulmonologist alongside being a member of the Corona Expert Advisory Group and the Technical Working Group Punjab. Assalamu alaikum ji and welcome to the show. My second panelist for the show today is Professor Bilkis Shabir Saiba, who is the chairperson of the Department of Medicine. She's also the in charge of telemedicine at King Edward Medical University, and she's also a member of the Corona Expert Advisory Group Punjab. Assalamu alaikum, madam, and welcome to the show.
Walaikum salam. Thank you, Fatma.
You're most welcome. And my third panelist for the show today is Ms. Minahil Ahmed, who is an analyst. Assalamu alaikum ji and welcome to the show.
Assalamu alaikum. Thank you for
You're
calling
most
me.
welcome, Minahil. Now, to get the conversation started with you, sir, I think we must talk about the basics. We have seen, this surge in the Omicron cases, more so in Pakistan in the past few months and more particularly in the past few weeks, so to speak. So what reasons, what factors do you attribute to the same?
If you look at this, the global phenomenon, not just the Pakistan phenomenon, that there has been a kind of resurgence of the coronavirus. But do remember, corona never went away. We do have the waves just coming and going, but it was always there. And sometimes there's a resurgence in those cases. One of the major factors all over the world has been the global travel. People do travel across the countries and they bring one kind of variant to the other country. Pakistan was no exception. We got our first cases coming in was again from South Africa, especially this. When we talk the subvariant of Omicron was what is called BA5. So it was kind of an imported variant to Pakistan as well.
So when we talk about, I think, the subvariants, I think it's very important for us to talk about the fact that, it's just not BA5, then there's BA4, then there's BA2 as well. But moving on, sir, when we talk about the, resurgence or the re-emergence of this variant, so to speak, not only in Pakistan but world over, do you feel that, this is just a surge that we see off and on, which we have generally been seeing since the pandemic started, or this could possibly lead up to another wave building up?
If you look at it generally, I mean, from the for last 2 years, every passing subsequent wave have been milder than the previous wave. Milder means that it does not cause force the deaths or the sickness leading to hospitalization. So I think we are going to continue to see this kind of waves coming in, but in a milder form. And also remember that if the virus has to survive, then it has to change its nature.
It has to keep on mutating that way, basically. But sir, I still think it comes with a danger, because you don't know at the end of the day that, what kind of mutation it might possibly take, how severe it could possibly be, on which I'll come to you, madam. I think when we make a comparison, it's very important for us to understand, especially for, people who are watching this show, that how do we compare and contrast the Omicron subvariants as they do exist right now to what were there before, because we did have the Delta variant as well, and then before that other variants too. So in terms of the symptoms, the clinical symptoms that people feel, in terms of the recovery rate, in terms of the death rate as well, where do you draw that line?
First of all, I must thank you, Fatma, for holding this very pertinent discussion at a very important point in time, because this is a time we should be creating more and more awareness. As far as the difference in the presentation of the various variants is concerned, the basic clinical features are the same.
Right, madam.
So fever, upper respiratory tract symptoms, which include flu-like symptoms, sore throat, cough, fatigue, palpitations. There was a little, we noted loss of taste and smell with Delta,
That's
which is not
right.
that observant as far as Omicron is concerned.
I think the
But
focus is more on the voice. I think people who have gotten this variant.
It's variable. It's
exactly,
variable.
it's variable at the end.
And not to forget, some people just present with fever and gastrointestinal symptoms, so
Right.
diarrhea, vomiting.
But
So
madam,
it's
I
a-
think considering that you've then highlighted all these basic symptoms at length, where do you draw a line? Because if I were to look at it objectively from a common man perspective, I think some of the symptoms were those which would actually overlap with the common flu and cold. So how do you draw that line that until unless of course you get tested, you have a test to actually testify that? How do you draw a line whether you have a flu, a routine flu, or whether it's actually just unfortunately you've gotten the Omicron variant?
There is absolutely no line. COVID can be absolutely asymptomatic. It can be mild, moderate to severe, depending on how much extent the various organs are involved, depending on how it behaves, how much oxygen a patient requires. Sometimes a patient might have very severe symptoms in way of having severe headache or severe body aches, but would be categorized in the mild variety because they are not oxygen dependent. And then we have clinical terms of moderate and severe.
So I think the advice to people out there would then be that if anybody has any of the symptoms that you've mentioned, that just isolate yourself and test yourself, on which I'll come to you. I think when we talk about this, we should get a young youth, common man perspective too. So when we talk about COVID-19, one thing I felt over a period of time, Minahil, is that we as a society, I think we've become very complacent with the virus, because I think people now are so tired and they are kind of, unfortunately fed up of wearing the masks all the time and observing, social distancing. So how do you see this? Because we have seen that, a lot of things socially have been, impacted by the virus.
True. Actually, everyone has to go on with their lives. They're just treating it as normal flu. If they don't, they can't work. They can't sit at home and work from home all the time. And the businesses, they were affected a lot. As I'm an entrepreneur, we run a few businesses, so we were affected a lot. All we can do is we can ask our staff to get vaccinated. That's what we can do. Otherwise, if we keep on pressing that point that it's very dangerous,
right?
It's going to affect their mental health as well,
right?
And that's what affected most of the people.
And I think this is one of the reasons why people have stopped wearing masks now. I think it's something which I earlier mentioned, that we've become very complacent with it. And I think in this regard, what is also important to see is that when you don't see others actually
wearing it,
complying with the SOPs, wearing a mask, and I think that in itself kind of gives you validation not to do it, because we live in a society, we live in a community, so we do derive some kind of a validation from the attitudes of other people, on which I'll come to you. I think we must draw a very important difference. I think clinically madam was kind enough to highlight the differences, but when we talk about the severity of the disease, I think one way in which we can actually distinguish Omicron subvariant from the other variants which did exist before it is that it's said to be not as severe as the other variants were. So practically, considering that you do see a lot of cases every day, do you feel that this is a fair and a just comparison to make?
I think it's pretty fair, because for any kind of infection or epidemic or pandemic, what you are concerned as a healthcare provider is that how far our healthcare system can sustain it, how we can cope with it. Do we have enough resources of our hospitals, the beds and this human resources that we can cope with the pandemic? There was a period, if you could remember, I mean, all over the world, especially our neighboring country, they were short of beds. They were running out of oxygen.
That's very right,
they were running out of the staff as well. But that's not the case now. The hospital beds are empty. 98% beds are now empty currently. So
but sir, I think in this regard we must also talk about the fact that when we talk about severity, I think we must also talk about the fact that in terms of it being more transmissible, we have seen that this particular variant is more contagious. So would that not kind of add an added burden to our already burdened healthcare system?
I think transmission is one aspect, but the important thing is how severe, how badly it affects the person. Because that's what we are concerned about. That's what the states are concerned about. That's all healthcare systemic concern.
So you don't see many people actually coming up in hospitals?
I don't see at this point. If you have milder disease, you can isolate yourself at home. So the healthcare system does not come under pressure at all. Yes, as I said earlier on, if the virus has to survive, it has to change its nature and it's become more transmissible as well. So we are going to see that. Any new variant coming in will be more transmissible, but not causing a severe disease. That's what we are concerned.
Right. But sir, then how do we justify the figures that we see, although of course they are very minimal now, of the people who do need to go to the hospital, or for that matter who are actually, you know, can't make it because of the virus. Basically then those are the people who were previously also vulnerable. That's the same category translated on to this variant as well.
Yes, absolutely, it's the same.
Right.
There's no much change in that.
Right, so your point is noted, on which I'll come to you, madam. I think we must also talk about, you know, telemedicine, as we do see it developing over a period of time. And I think in this regard, we've seen King Edward Medical University taking a very, you know, a forward step in that regard, building up this whole telemedicine unit in which you're not only educating people about the virus, but also kind of intervening and, you know, giving them the right referral, or for that matter, the right advice that they do seek. But telemedicine, as we do see it today, I think it comes with a lot of challenges too, because I think there's only so much that you can do sitting behind, you know, maybe perhaps a computer, or for that matter talking to somebody on the telephone line. So how effective do you feel has it been in actually, you know, fighting out this COVID-19 pandemic? And of course we've seen it develop over a period of time through these 3 years.
Fatma, telemedicine is not new to the world. But to Pakistan, I would just quote a quote from Maulana Rumi. The wound is the place where the light enters. I think this COVID was the wound that introduced this department of telemedicine onto the medical university. It was back the first, you remember, on the 26th of December in Wuhan, the epidemic was declared.
Right.
The first patient came to Mayo Hospital in Pakistan on the 26th of February, and it was on the 18th of March. It was the innovation and this idea, this vision was of the Chancellor of various medical universities of Punjab, that it came up, why not start up with tele-corona services, tele-corona health tests, where people are guided as to what the virus is and how it spreads, and how to avoid and what to do in case of an infection.
Right.
And I think the credit goes to the Vice Chancellor of King Edward Medical University, the then Vice Chancellor, Professor Khalid Masood Gondal, that he said that because at the same time, if you remember, there was this first lockdown.
Right.
And all the outdoors of the major tertiary care hospitals, they were closed.
Right.
And they remained closed for 6 months. And on an average, as I told you, it's about 15,000 patients coming to Mayo Hospital in a day. So where would these patients go?
Right.
So it was his vision that why not extend these tele-COVID services onto tele-OPD, and he extended them onto medicine, surgery, gynae, pediatrics, psychiatry. Psychiatry was very important, especially in those days.
But I think one thing, madam, which is very important, I think for the benefit of the people as well who are watching the show, that when we talk about telemedicine, I think it just doesn't make it, you know, easier to access doctor, also easier to access the healthcare system, because I think a lot of times people, more so those belonging to far-flung areas, and I think you would agree with me on this, those belonging to remote areas, I think one of the reasons why they are so hesitant to go and seek medical care is because, number one, they feel it might be costly. Number two, they might just feel that, you know, accessing a hospital per se or going to a doctor would be so much full of hassle because it might be just too far from where they are living. So in terms of that, do you feel that, you know, telemedicine has been that thing which has actually helped us, you know, overcome this problem?
Absolutely, Fatma. Thank you for asking me this. This is something very dear to me, because we were able to receive calls and attend to patients from areas I had never heard the names of those places.
Right.
Such outreached and underprivileged areas. More than 18,500 patients have been catered up till now from more than 75 districts across Pakistan. And expats, Pakistani expats from countries, more than 25 countries across the world, especially
and you've also
the Middle
got
East.
International recognition, which is great.
Yeah, especially from the Middle East, because as you know, the expats who are working there, they're basically, they belong to the working class. They cannot afford the dinars and the dirhams and the euros and the dollars. this telemedicine service is absolutely free of charge.
Right, madam, your point is noted, on which I'll come to you, Manail. I think a lot of times we generally just talk about the negative impacts that this pandemic has had on us, to which I feel there is no denying, because we have seen that, people's mental health has, deteriorated over a period of time. But when we talk about, the positive impacts, more so the positive social impacts, what do you feel are the most pressing impacts in this regard?
In general, we actually got to spend time with our families, which was good. And if we talk about the climate as well, pollution rate went down. We could all see clear blue skies in that time.
After such a long time.
Yes, after such a long time.
But that I think was also very temporary, because then again, when the lockdown restrictions were eased, people started coming out, and of course I think the air was polluted again. But I think one thing which you very rightly mentioned is that I think it gave us that time to actually spend time with people, with our beloved ones, more so our family. And also I think at a very personal level to introspect things perhaps which we didn't do before. And then we saw so many things otherwise happening. I think one very positive change of this pandemic has been that, at least for me, there is a shift more towards, simple weddings.
Yeah.
Something which didn't happen before.
True. Fatma, where you talk about positives, yeah, there are negatives and we don't need to elaborate. There have been tragedies in the family, and I hardly know of anybody who has not faced COVID or a relative having died or suffered from COVID. But as far as the positives are concerned, I can, you were just discussing about mental health. I think the stress on mental health, I think over the last 25 or 30 years of my career, I think COVID were the days when it was stressed the most. And it has actually, we did a lot of training of young doctors, senior consultants on mental health issues, how to deal with the anxiety associated with COVID. And that has not only been beneficial for COVID only,
Madam, I
but
think
for
it has started so many important conversations which we were never having before. So I think another way to look at it is that, of course, it has given us that opportunity to prioritize mental health, which perhaps we were not doing before, among so many other things.
And Fatma, very importantly, I must mention reaching out. We were able to extend on to international webinars. We held national webinars. We were able to go online as far as education and medical education is concerned, reaching out to poor areas and to DHQs, THQs, where doctors, we could discuss patients one-to-one.
Right, madam. Sir, you wanted to add something to that?
Corona is a unique disease in the history of mankind. That's we must remember. No disease ever has affected so many people at the same time. During these 2 years, in terms of research, there are more than 600,000 publications in the world. And at any one stage, WHO data contains more than 100,000 papers in their database. You have a research going from one end to the other end. This is the first time in history that in December, Corona first time was diagnosed in China. Within weeks, the sequence of the virus was up on the website, so they can make any vaccination. Within 2 months, they have exactly described what this disease is, symptoms, only in 99 patients, and subsequently in 1,000, which has not changed. So much research has gone into in the countries which never
heard. So of course we've come such a long way. This is the 3rd year of the pandemic now.
And then you can whole list of things, not only medically, but the first time the world learned, yes, we can work from home. We don't need big offices. We don't need all these traveling.
We can seek an education sitting at home at the end of the day.
As Professor Balkis was mentioning, you could reach to any corner in the world where there is an internet.
Right, and I think in this regard we must also talk about the vaccine hesitancy, which still unfortunately continues to exist not only in Pakistan but also in different parts of the world. I think it's something very rampant in the US as well. So when we talk about this vaccine hesitancy 3 years down the pandemic, how do you feel has it been, and do you feel that there has been a surge in it, or do you feel with the passage of time people are more kind of accepting towards not only getting the vaccine but also following up on their booster shots?
That's right, because there is a kind of complacency. I mean, as you said, for 2.5 years we had lived with the corona. People just start learning to live with. However, it's very important to point out that a certain group of people do need a booster dose. The ones whose immunity is decreased by any reason, whether they have chronic health illness, who are elderly, and they must get a booster dose. As the time passes, our immunity goes down to the booster dose. Anybody who has taken the last vaccine 6 months ago should get a booster dose. Because that will help to help him to prevent a serious disease, as we all know now. The vaccination saves us, saves lives, and saves us the serious illness.
Right, so your point is noted, on which I'll come to you, madam. I think a very important point for debate and of course clarification is the fact that, people often are confused that, what is the right time after which they should follow up and, get their vaccination booster shot. So what do you feel is that ideal interval or ideal time after which they should do the same? Because I think the authorities here, they themselves are very divided too.
Yes, this is very important to address at this moment, because this is a time when we have reached about 62% having received their first 2 doses of vaccination, and now it's time for booster. It is very clearly mentioned in all guidelines, including the guidelines of Corona Expert Advisory Group, which are the local Pakistani guidelines, that the first booster should be given within a period of 5 to 6 months following the second dose of Sinopharm, which everybody received in our country.
Right.
And as far as the 4th booster is concerned, CDC, that is Center for Disease Control, has advised another booster following the first one 4 months after the injection.
Right.
So basically it's, as Dr. Javed pointed out, it's the waning of immunity.
Right.
So the best is, we know these are the international guidelines. A person who is at high risk, elderly, having comorbid conditions, person having immunocompromised status, people like us who are healthcare providers as well as healthcare workers, they should go for the vaccine instead of getting their antibodies tested.
I think, madam, you very rightly so pointed out all the categories, but at the end of the day, I think nobody is safe until unless everybody is safe. So everybody needs to get it at the end of the day. And I think in this regard, Minail, the media has an extremely important role to play, especially when it comes to, sensitizing people about the need to go out and, get their necessary vaccination booster shot. So what role perhaps can media, more so social media, play in this regard?
I think a lot of celebrities and influencers, they were very active in the start. They actually encouraged people to get booster shot, and then it was very necessary for all the work staff as well to get the booster shots or vaccines done if they want to come work over there. But I think they were very active in the start. They're not active right now. I'm sitting here and I got to know, and there's another variant which we just talked about. So we were discussing and we were reading all these things about different variants that were coming, but now people tend to just relax about it. They don't want to read about it because they really want to go on with their lives. If they keep on reading, that's affecting their mental health. All they can think about is, oh, when's there going to be another lockdown, or when, how is that going to affect their business?
That's very rightly pointed by yourself, because Minail, I think somewhere we've made that, it's kind of a willful blindness. I know a lot of people, especially young people, who are, in their zest, carrying on with their lives, so to speak. They've kind of accepted that yes, there is a pandemic, we are living through a pandemic, but this is the way that we are going to proceed. And this is something very real. I think you would agree with me on this, that a lot of people who have gotten their shots, something which I was earlier mentioning to Dr. Saab as well, they are not very willing to get their follow-up booster shots, just because they feel that it's not effective or they don't need it, or if it happens, then it happens.
No, in general, actually we were discussing about it with Dr. Saab as well, that we all got to know women should not get it because of the infertility issues, children should not get it because it's not necessary. These were the things a few people actually started talking about.
That's very right.
And on media. So I won't say that media was completely positive about it.
Right, Minail, your point is noted, on which, sir, I'll come to you. I think we must also talk about, a lot of myths which do surround COVID-19, more particularly the Omicron subvariant. I was reading this report which suggested that, people who are used to actually fasting, or who for that matter practice intermittent fasting, they are in a better position to fight off, the COVID-19. Even if they get it, they don't get it, as seriously as others perhaps might do. So when we talk about, debunking all these myths, what are the most annoying myths that you come across, and how would you, actually debunk them using today's platform?
I think the myths which everybody very early on in the pandemic, that you will die after 2 years.
Right.
That was the biggest myth, and which was spread all over the social media. And the person who was quoted having said that, he said, my statement has taken out of context, but people never going to listen to it. Second, Corona does not exist. Third, it is a laboratory made, and this is a conspiracy against whoever it is.
Sir, but I think to a great extent we've moved past that.
These are the big myths. And then, of course, fertility, the pregnancy, the genetic manipulation, the DNA will change, all these myths we have passed through. And the last is the efficacy.
Right.
Is it really working? That was a big question mark. In America, people are worried that you have produced a vaccine, which is new messenger vaccine, which is a new technology, never been used before. We do not know what is the long-term effects of this technology. And it was very genuine, a right question. We do not know what it is. And we are going to use this technology during this pandemic. So all these myths has been broken over a period of time.
Right.
Now we have billions and billions of doses have been given without those side effects.
Right.
Efficacy still remains a question.
Right,
How
sir.
effective it is. But no doubt, if you look at not what people do is they try to see, okay, I got a vaccine, I got sick. It was never said that vaccination will prevent infection.
Right,
It
of
does
course.
not prevent infection, but it does prevent a severe disease.
Right.
It does prevent you going
Not going to the hospital.
and getting sick. So I think these myths
These are
one
the
by
things that we
one
need
have
to
been broken down.
basically.
Now comes the compliances.
Sir, but what about, we've also seen that, over a period of time that COVID-19, initially it was said that, it doesn't affect young children, so to speak, but now we see children being affected by it too. So how do you see it, affecting the immune system of young children?
You're right, very, very early on, children, either they were not infected or they were having a mild disease. Then came a time when the children have very severe disease, which called systemic inflammatory syndrome. There were multiple systems were infected. So that myth was broken again. One of the myths was broken at that time.
Right.
Children are now getting infected. In
Right.
fact, children became carriers. If school were closed down for simple reason, the child will bring infection from school.
And sir,
to
a
the
lot
home.
of children are actually getting very seriously affected by it.
They
too.
are,
I've seen
absolutely
very
they are
young
affected.
kids, they were being hospitalized as well because of contracting the virus. But madam, I think sir has raised some very valid points on which I would want you to deliberate further. When he talks about the efficacy of the vaccine, I think a very important point which we must consider now at this point in time is that the vaccination, when it came, it was originally perhaps tested on a variant which was very different from this Omicron variant that we have now. So how effective do you feel overall then would this particular vaccine be to actually help us develop immunity against the Omicron variant?
Actually, the virus is going to mutate. So today we have Omicron, today we have BA5, tomorrow we are going to have BA6. And we have seen that over
Right.
the last 2.5 years. This, as far as this variant, if you ask me specifically, is concerned, it is very clear that the patients who are hospitalized, if we take their history and interrogate into their vaccination record, 98%, this is data coming directly from Mayo Hospital, 98% of patients who are admitted in the HTUs and the ICUs, high dependency units, they are unvaccinated.
Right.
So this tells you, gives you the answer how effective
Is the
vaccination in preventing the severity
of the disease basically. Right, madam. And I think in this regard we must also talk about these various cases that we have seen more so in UK, where people have said that they've actually contracted a variant, a sub-variant at one particular point in time, and then 4 to 6 weeks down the lane they've actually contracted another variant. So isn't this kind of scary, you being actually contracting the virus 4 to 6 weeks after you've actually contracted it? Because shouldn't this ideally, medically speaking, be the time in which you've actually actually develop immunity against that virus?
Actually, it's a variant. It has mutated. It has different transmissibility. Its structure has changed. So it has the ability, for example, we'll talk about Omicron, BA5, which is the current variant very much in. It has more transmissibility because its spike proteins, you know about those spiky projections on the surface of the virus, they have more capability of binding with the respiratory passages. So that is why there's more transmissibility. But as far as penetration into the tissue and resultant severity of the disease is concerned, that is less.
Right.
So with every mutation, and mutation doesn't always have to be bad, you know.
It can also, I think time has proven, I think something which earlier docs have also said, that, you know, with the period of time we've seen the virus be less lethal, be less dangerous, and this is something that we live through. Another thing, madam, I think which would be of, you know, real interest to our viewers out there is the fact that we have seen cases, you know, where scientists have also said that, you know, there is this category of people, whoever lucky those people are, who actually are genetically resistant to the virus. So even if they were exposed to the virus per se, they would just not get it. So how do you explain this?
Well, Allah Almighty has made everybody unique. So it's not only genetics, it's the immunological system, it's the personal behavior. So many a times, if I compare myself with, for example, yourself, you may be taking all the precautions in the same environment, while I might not be. So then secondly, the immune response. Everybody has a different immune response, and we also label it as immune memory.
Right.
It might be that some individuals have had corona infection of some other, not COVID-19, of some other virus of this family previously and are immune to it. Like just like you just talked about this, that
basically
one infection leading on
which
to the
actually
next
gives them that immunity basically, because, you know, we've seen a lot of cases where, you know, couples have contracted virus, but, you know, the children haven't, or on the contrary, you know, if a wife has contracted virus, the husband hasn't. So I think these are the things which actually explain. I think your answer explains all these gray areas.
But it's very important, Fatma, to point out that those who have as yet, they may feel that as yet they have not been exposed or suffered from COVID, they should not rest assured that they won't ever in their life.
But then, madam, again, I think if you are genetically resistant to it, or if, you know, if your genetics are immune to it, so I think at some level you get that protection.
Yeah, but we are not sure. But only time will tell.
I think these are again those gray areas which we can't, you know, pinpoint and, you know, put an answer to. On which I'll come to you, Manahil. Basically, I think we must also talk about this whole concept of, you know, CSR, corporate social responsibility, and we did see it actually, you know, gaining a lot of popularity during the pandemic, not only in Pakistan but world over too. So how do you feel can, you know, we all, you know, in our respective capacities, be it people from the business community, be it fashion designers, be it healthcare workers, or for that matter community at large, give back to the society more so at a time when, you know, we see that, you know, this dividing line between the haves and the haves not, that has deepened, because we can't ignore the fact that the COVID-19 pandemic has had a very negative impact on us economically as well.
Well, everyone was actually looking at the positive side to everything, even though the negative was at large. I think a lot of people who were actually suffering from COVID, or in general, if they're facing any difficulties in their businesses, all they could do was give back to the society. And how could they do? They actually started encouraging people that whatever the doctors are doing, they're doing their right job. Otherwise, people were not really happy with the doctors doing all the, you know, the part they were playing. People were not really sure about it at first.
Right.
But after some time, they were very positive that whatever the healthcare workers were doing, they're doing the right job. And just to give back to the society, how the businesses did was, the owner of the dessert place, he started making these kits at home. There was a fashion designer who was making these kits at home.
Right, and I think in this regard we also saw that, you know, not one, rather quite a few designers were actually running these mental health awareness campaigns too. I think in this regard a lot of people have come forward with their ration drives too, and I think the community at large has been very, you know, basically giving back to the society in whatever way way they could possibly do that?
I had a few friends who were coming back to Pakistan, and they spent 3 to 5 months giving back to the society. They went into these urban areas and they started helping these people. We were donating. There were a lot of other people who were donating that could not actually go in there in these areas. So these people who came back, they actually helped the society in that way. If I talk about youth, there were a lot of my friends who were coming back to Pakistan, and they were going into these areas where we all people were donating, and not everyone could have access to all these things. So they went into these areas, they were helping a lot, and I think that's how they gave it back to the society.
I think everybody was giving back in their own, whatever they could do in their own respected rights. Yes, madam, you wanted to add something.
Fatma, I would like to share here that there was not a single day in Pakistan that we as healthcare workers did not have a kit or the PPE, because if it was not available from the health department, we would have them from the people around us. So people donated so much to the hospitals and the ICUs. It's highly appreciable, and I think the credit goes not only to the common man, but also I would like to, and I think Dr. Javed would bear with me, the doctors and the nurses and the paramedics.
I think the healthcare workers,
they would become positive. They would stay home, isolate, get treatment, and the day they would turn negative, they would join back.
On which I'll come to you, sir, and coming towards the conclusion of the show. I think madam has raised some very valid points, and I think from this emanates a very important question for you. I think we must talk about the lessons that we all have learned at the end of this, pandemic, which is still in a way continuing. It hasn't come to an end, but of course the severity of it has lessened. So when we talk about the lessons, so to speak, what do you feel are the lessons which you, very important frontline healthcare workers have learned, and what are the lessons which you in turn would want to pass out?
When there was a challenge, there were opportunities, and I think it gave us a chance to look at it. When you look back 2 years ago, where we started and where we are today, and what difficulties we faced, and how we coped with it. So there are positive things which I can share with you. Globally, the whole world got together to fight this pandemic, not only in research, in terms of treatment, in terms of management, but new ideas, new COVID innovations during this pandemic. The community, that how to survive during these difficult times. It has been discussed. I mean, the lockdown, the isolation, time spent with families, telemedicine again, first time, not only in Pakistan but globally, it came up. That we can reach out to all the communities across the globe through the telemedicine. Wearing of the mask, personal level. I think I can see not only that it protects you, but especially the females, the fashion industry in the mask.
But sir, even they have come, they've actually learned to come around it. I've seen the focus of the makeup trends changing now, from basically all the focus being on the eyes with the mask.
So mask became a part of your dress. It had. I mean, it saves you from that.
And then we've also been having, matching masks to go with the clothes. A lot of designers came up with that too.
Wearing the mask, hand washing. I mean, a lot of places do not have the facilities for the hand washing. We learned that we need to have hand washing facilities, and that's very, very useful. In fact, there's by World Health Organization, they observe 1 day hand washing day. It's such a simple thing. It's natural to wash your hands.
But so I think at the end of the day, if you were to, kind of sum it up, I think COVID has actually reintroduced us back to so many basics. Basically, and for the better, for the good at the end of the day.
It's changed the world.
It has changed the world. And I think one should look at it also positively rather than just, of course, all the time just gloating over the negatives. Right, sir, your point is noted. Coming towards you, madam, I think when we talk about, of course, COVID management, we don't know, like sir rightly so pointed out, that when exactly will we be out of this pandemic, and we can't say that, how many more mutations can we actually have or expect in the future, so to speak. But when we talk about, tackling this pandemic, pandemic, we of course have to do it within certain parameters, and in this of course we have to give due importance to other diseases that people suffer from as well. So how do you feel can we, strike that balance? Because at some point during the pandemic, there were some concerns being raised that, if you were to tackle COVID-19, if all the focus was to go to COVID-19, then how would you tackle, people who are suffering from other diseases?
Absolutely. I've just mentioned that this was a big brunt on the other patient, and as I said, outdoors were closed. So dealing with COVID, many other patients who were coming for routine follow-ups, for routine surgeries, for elective procedures, they had to be halted for some time. And this is again where I mentioned the importance of telemedicine. This is a way of reaching out to people. In Surah Maida, Allah Ta'ala tells us, if you save one life, it is as if you have saved the whole mankind. If through your program, we are able to let people know, and they can further spread the message that this is a facility absolutely free of cost, and it's very easy to communicate. I'll tell you, for a person who doesn't have any internet, coming from the most rural of the places,
Right, madam.
they can use landline numbers. They are available on our website. Then people can contact us on WhatsApp, routine WhatsApp phone calls. They can make video calls. They can use Skype. And recently, Professor Khalid Masood Gundala, Vice Chancellor, he introduced the telemedicine KEMU app, which is available on Google Play Store. So it's just a click away.
All you need to do is just install that.
Just install it. You want to consult a cardiologist, a click. You want to, you're upset, you want to talk to a psychiatrist, just a click.
And this is completely free of cost.
Absolutely free of cost.
If not anything, at the end of the day, I think people get that direction that, what next to do, of course, because you can't properly treat people through, that app or for that matter, through telephone or the internet.
And we can let them know the red flags. That this is a time you should go to an ER, you should go to the nearest healthcare facility instead of staying home.
And I think in this regard, this is extremely important because, madam, early intervention is the key at the end of the day. But coming towards you and to conclude today's show, I think a very important thing which we must ask you, since you are the youngest on the panel here today, that what role can young people play in this regard, especially when it comes to creating awareness, when it comes to sensitizing masses about the need to get vaccination and their booster shots, or for that matter just complying with the SOPs, strictly speaking, because I think one thing we've all learned at the end of the day is that prevention is better than cure.
Yeah, actually we can start from our own houses, from our own house staff. We should make sure that they get vaccinated, because there were a lot of people who were not getting vaccinated. They did not have knowledge about it, or just like all the myths that we recently discussed. And secondly, if you're running a business, you should make sure that all your work staff over there is vaccinated as well, and you should keep on talking about it, because after a booster shot, how many times do you need to get vaccinated? You need to discuss all these things. In the start, we were discussing SOPs, we were actually forcing them to get it done. But after some time, I think we've become complacent at the end of the day. So I think that push needs to come from everybody in their own respective right. And we should always, so there are so many apps. We have Facebook, we have TikToks and all these things. So influencers, they need to make sure that they are sending that message through these apps, because I think most of the masses in Pakistan, actually, they are on TikTok.
Yes.
Everything is on TikTok. I think they should keep on doing it after some time.
And I think this is a very intelligent, actually, I think, recommendation, because TikTokers, I think they have that level of engagement, especially to those people who otherwise perhaps don't, have that access to electronic media, or for that matter don't read newspapers. So I think TikTok, or for that matter any form of social media, I think that would be a very effective means of communication, and of course educating people about the need to protect themselves, and of course by that virtue protect the community.
And I think they did a great job, because in the start when I was going in the market, people who are like from the lower to lower class, not really middle to lower, there's a lower to lower class, all these people were saying this is rich people's problem, this is not our problem, and they were so okay about it, not getting vaccinated. So I think when all these influencers got into this, they actually created a lot of awareness for all these people.
Right.
So I think they should keep on doing that.
Right. So you basically feel this is a momentum which needs to continue, on which note I would like to conclude today's show. Thank you so much, Dr. Saab. Thank you so much, Madam. And thank you so much, Ms. Manayal, for being here with us today. Well, to conclude today's show, we generally spoke about the spread of the Omicron variant. We also spoke about the very pressing need to very religiously follow all the SOPs as they have been, mandated upon us. Having said that, what is very important is that we do take this virus seriously, more so when it comes to leaving all those complacent societal, attitudes that we unfortunately have developed over a period of time. Having said that, at a very basic level, I think we all need to understand and appreciate the fact that nobody is safe until and unless all of us are safe. On that note, signing off for today. Until next time, take care and Allah Hafiz.